Okay, so I'd like to introduce Trey Sebrell is on our advisory board for the nonprofit, and when we started this board, I think it was Alan Rappaport recommended that we got somebody from the community, a local person from the community. So I came back and looked at my roster of all my patients, and I wanted to find somebody who had a very impactful story, who was also well-spoken and would represent our state and represent us very well. So I want to introduce Trey Sebrell, and his wife is back there as well. She's here for moral support. She won't. But Trey, thank you so much for being here so early on a Sunday. And please tell your story.
Be glad to.
And the good news is that we're going to have his story first for about 15 minutes and then see if the coffee's ready.
Do I need to use the mic, or can everybody hear me? No, use the mic. Okay.
And we can take it off and walk around.
Oh, that'd be. So, like Christina said, my name is Trey Sebrell. I have graduated from Jackson Academy here in Jackson and Ole Miss for college. And I first started getting migraines when I was in college. Must have been my sophomore year. At first, I thought, well, you know, I've had too much to drink. It must be that. But I kept getting them and getting them and getting them. So I went to see a neurologist and had the CAT scan and MRI because my mother was concerned that I had a brain tumor. No brain tumor. Back, I guess, when I graduated from college and began to work, I started getting migraine headaches every month. And they would come on with no symptoms whatsoever. It would just be all of a sudden migraine headache, just like that.
Let me interject something here, because this is a good point. Somebody asked me about this yesterday. So I talked in my talk, there's something called migraine typically does not come on all of a sudden that fast. Migraine, you know, thunderclap, but migraine typically has a gradual build. So you have what we have called crash migraine, where you go from 0 to 10 within about 30 minutes and you're vomiting, right?
Right, okay. That's exactly right. So I would be, I own a funeral home, so I would be at the funeral home, and all of a sudden I would become nauseous, headache, all of a sudden, just like it just came on like Christina said, like a thunderclap. So I would go to the emergency room, and they would give me Dilaudid or Demerol and Phenergan, which would put me out of commission for about 3 days. And I would be fine, and then 30 days later, the same thing. I'd be back in the emergency room, Demerol, Dilaudid, and Phenergan. And this went on for 3 or 4 or 5 years, just like that. Every 30 days, same routine. Well, through the course of this, obviously, the doctors and the nurses in the emergency room thought, well, this is a drug addict. He's a heroin addict. He's trying to come down from some sort of medicine. Well, they were ready to put me in rehab, because what else would you do? I mean, the folks at the hospital just weren't used to seeing this kind of environment where all of a sudden you can't look at the lights, you can't eat, you're throwing up, your head's pounding. So on the advice of my mom and on my wife, who's back here, I went to see Christina at the Headache Center. I had never heard of it before. Christina diagnosed me with crash migraine, which I think you said affected one, and it's very rare. Very rare. So through that process, Christina has placed me on a preventative medicine and given me the shots. Since I started becoming a patient of Christina's, I have not been to the hospital for a migraine headache in years. I haven't had to go to the emergency room. I haven't had to have a shot of Phenergan or Dilaudid or anything like that. So by going to that headache clinic, not only did it save my life, but it also gave me my life back, because I was missing so much work that it was costing, it really was costing my business, because I wasn't there. But probably 3 weeks out of the month because I was dealing with a migraine headache that no one understood. People thought I was crazy. People thought I was a drug seeker. People thought I had a mental breakdown. They didn't know what to think. But she did. She knew. And so if I had not gone on the advice of my mom and my wife to this, I'm not sure where I would be today. I mean, they'd gotten that bad. My wife suffers from them as well. So my wife is a patient of hers as well, and she doesn't have migraine headaches anymore. In fact, she's been able to come off all of her medicine, and she's been just given the Trexamet. Is that how do you say it? Yeah, Trexamet. And that works fantastic for her. And because of the regimen that she has me on, I don't have to have any shots. I do have the emergency shots, but I don't have to take a shot. I don't have to take Phenergan on a regular basis. I don't have to do anything because I haven't been nauseous. I haven't been sick. I haven't had to go to the emergency room. I hadn't had to do anything. But imagine going and having to go to the emergency room every 30 days. And imagine what that would do for the professional in the hospital to see me every 30 days with the same symptoms. Literally, if I saw that, I would think I was a drug addict. It's drug-seeking behavior. I might try to put myself in rehab. No doubt about it. But since I started with her, literally, I have 0 migraine headaches, and she has helped me get my life back. So the only thing I can say in closing, what y'all do, everyone in this room, saves people. Y'all, headache medicine and doctors and nurses, nurse practitioners, y'all change people's lives. You may not realize it, but you do. You may not hear that a lot, but you do. For every migraine sufferer who does not have a migraine because of what y'all do, you've saved someone's life. And you've given their life back. So I encourage you, whatever y'all are doing, keep doing it. Keep doing it.
We need you in D.C. with us in February.
Well,
But the problem is, the drug that saved his life, Imitrex injection, came out on the market in 1991, so about 30 years ago. And you couldn't get a drug that was 30 years old, that was prescription miracle for migraine, in all the hospitals, the doctors, the neurologists, for all these years. And then also, what you were talking about, almost losing your life, even though it was only once a month, you were terrified all the rest of the month.
I was panicked that at any second, at any time during the day, that all of a sudden I was going to get a migraine headache. I was scared it was going to be on a funeral, or when I was with a family, or if I was in the middle of a service, if I was driving, or it was paralyzing because I didn't know when it was going to happen. It was like living in fear because I had no idea at that moment, was that going to be what's going to trigger it? Am I not eating? So I'd eat. Am I not drinking enough water? So I'd drink a lot of water. It had nothing to do with that. But I lived in fear for many years. When I moved to Nashville after college to attend mortuary school, I went to, had a migraine headache, same thing. And first my family physician put me on Enderall, which was a disaster. It just didn't, migraine headache would break right through that. So I had to go to a hospital that I have never been to in my life, never. And trying to explain to someone who has never seen your medical records, that doesn't have any track on you, that you have migraine headaches, is like trying to explain to someone that you have cancer and they can't see it. It's a debilitative disease, but they think particularly if you don't have any records of it at a hospital, they think you're nuts. And people that don't have migraine headaches think you're crazy. And that is really one hospital that absolutely almost put me in rehab.
That's the good part about part of I think Bill Young's work at Jefferson Headache, and he also runs Headache on the Hill, is to decrease the stigmata and shame of having migraine, because after a while people won't even tell you that they have headaches because you're going to dismiss them. And there's a stigma that if I can't see it, is she telling the truth, because it's based on history. I mean, for you it's a little easier because you vomit on people, you know. But not everybody can do that, you know. But so yeah, it's because it's a silent condition. It's the forgotten epidemic, and even my own daughter, I'm like, is she just trying to get out of school, or does she really have a headache? She's 14, you know. Is it social anxiety, or does she have a headache? So, yeah, we're trying to get rid of and they did. This is beyond me. We call them migraineurs and cluster heads, and they don't even want us to call them migraineurs. They want us to call them people with headache, migraine, but I like migraineurs. So, but yeah, we're trying to change things. But at Headache in the Hill, I think your story would be very impressive to maybe our senators and our congressmen.
Glad to do it, 'cause what everybody does in this room is important. What y'all do I can't stress that enough, what y'all are doing in this learning and studying, and yesterday I heard some of the doctors talking about scientific studies and things like that. What y'all are doing is important. People like me and other people with migraine headaches need that science, need what y'all do, because it is very important to people like me. Because without y'all and without Christina, I don't know where I'd be today. I just don't. I may be in rehab, or I might have ended up dead. I just don't know.
We're going to help us start the movement.
Oh, I'm happy to do it.
Okay.
I really am.
Good. Thank you so much.
Thank you.